Good afternoon. My name is Dr. Michael Reed. I'm a dermatologist. I specialize in treatment of hair loss in men and women, both medical and surgical. I'm a professor of dermatology at NYU Medical Center, where I teach the residents these skills. This afternoon, we're doing a video on a new procedure called platelet-rich plasma injections, or PRP for short. I'm going to discuss what the procedure is, why we do it, who we do it on, when, and then I'm going to show you how we do it on the patient. First, what is the procedure? It is a procedure simply put where we take a sample of blood from the patient. It is then spun down in a special centrifuge, which is provided by Harvest Technologies. After we separate the serum and the platelets from the red blood cells, we concentrate the platelets and they're subsequently injected into the scalp in areas of thinning hair. That's what it is. Why do we need this procedure? Well, at the present time, there is a gap between medical treatment and surgical treatment, which this new procedure may help to fill. Who gets this procedure? Basically, any patient with hair loss characterized by thinning hair can be a candidate for this procedure. When do we do it? We do it usually after the patient has had an adequate trial of medical treatment if they haven't achieved the results they would like to achieve, although some patients get it right from the beginning if they want to. Now, in addition, we're going to show you how we do the procedure. The procedure can be done any time that a patient is ready for it. They don't have to wait for it, and it can be done in virtually any circumstances. It's safe, it's effective, there's been no adverse effects to date. So next we're going to show you on a live patient how it's done. Thanks for your attention. This is Dr. Reed. We are now with a patient who's going to get the procedure done, which is platelet-rich plasma injections. I have discussed what PRP is, why we need it, who we're going to do it on, and when we can do it. Now I'm going to show how it's done. We have anesthetized the top of the patient's head with local anesthesia, so this is not a painful procedure. The blood has been prepared by spinning it down in the centrifuge. As I said, we've isolated and concentrated the platelets in the serum with minimum red blood cells, and we're going to now proceed to inject this into the scalp at the level of the hair follicles, starting in the back. Little small aliquots will be given. Okay. A little bit will be on the surface that we're going to rub around. This is not a painful procedure. This material on the surface will be reabsorbed into the scalp through some little tiny openings we've made with a device called the derma roller. I'm not going to wipe this off. I'm going to leave it on. The patient will have a gooey scalp tonight, but he can wash his hair tomorrow morning, and he'll be a civilian after he washes out this little material that we leave on top. Some patients report a little soreness for a few days. Most patients have no problems at all. There have been no complications from this procedure to date. In addition to the platelets that are in this preparation, we've added an extra material, a kind of a booster substance called A-cell, which is a collagen material that is non-immunogenic. There's no reported side effects, that acts as a booster and a kind of an activator for the platelets. Platelets themselves contain about 20 different so-called growth factors. They've been shown to make hairs grow better, both in vitro and in vivo studies. And in the studies done in humans, the doctors who've done this report an 80% success rate, defined as a noticeable increase in hair quality or quantity after 2 or 3 sessions like this. Our protocol is to do this at bi-monthly intervals for a series of 3 treatments. And after that, if we do get the results we like, we will do this probably once a year as a booster. Get off a little extra stuff here. As I said, this is a procedure in patients with thin hair. This gentleman, who's 35, does have early male pattern hair loss. A little bit more scattered around. We try to get this at a certain level just where the hair follicles are, which is in the deep dermis or upper subcutaneous tissues. That's where hair follicles reside. As they get older and they get smaller and finer with hair loss, they tend to be higher up. Also, hairs eventually in bald head become invisible. It's kind of interesting that there are no bald people, just people with invisible hair. That sounds like a joke and there's some humor in it, but it does mean that theoretically we could resurrect those sleepy hairs and cause them to come back to normal functioning, and that is the future of this field. This is the earliest kind of growth factor work from stem cells research, from embryonic stem cells will eventually derive growth factors, and platelet-rich plasma is the beginning of this new technology. It's exciting, it's new, it's different, it's safe, and we're looking forward to getting really good results. Thank you so much for your attention.